Anatomy of walking and gait cycle. Before going to the discussion of the gait cycle, I would like to explain about the propulsive mechanism of the leg because it's very important to understand the propulsive mechanism when it comes to the movements like walking and running. Foot is not a rigid structure, it's rather a flexible and resilient structure which is able to change its structure or the shape according to the surface. The propulsive action in walking is facilitated by the gastrocnemius and soleus, which are the superficial calf muscles, and this movement is enhanced by the foot arches and the flexion of toes. When in standing position, where the entire foot touches the ground, the body weight is taken by three areas of the foot. It is the heel, lateral board of the foot, and the ball of the foot. Ball is where the heads of the metatarsal bones occupy. And when it comes to leave the ground, the last part to leave is the anterior pillar of the medial longitudinal arch, which is the heads of three medial metatarsal bones and the medial three toes. For the interest, I'll explain what happens in running. In running, like in this picture, heel remains off the ground and toes and the forefoot taking the thrust of the weight. But the takeoff point is still the anterior pillar of the medial longitudinal arch, whether it's walking or running. When it comes to running, the gait includes various foot strike patterns, including heel strike. It means heel contacts the ground first, and then the midfoot strike, where the runner lands on the middle part of the foot, and then the forefoot strike. It is the runner lands on the ball of the foot or toes. In heel strike pattern, this is common for walking and can occur during slow-paced running. Midfoot strike is often considered a neutral strike and can be efficient when running. Forefoot strike is common for high-speed running and sprinting. Then we'll talk about the posture and gait. When standing at ease, it means while your feet slightly apart like this and laterally rotated with toes pointed outwards. In here, in this position, only few back and lower limb muscles are active, so the most of the muscles not get tired, and the hip and knee joint are in extended position and in their more stable position. In this position, these joints are in their maximal contact of articular surfaces for weight transfer, and the supporting ligaments are taut. The line of gravity falls between the two limbs just anterior to the rotation axis of the ankle joint, like in this position. Because of this, there is a tendency to fall forward or forward sway. This is counteracted periodically by bilateral contraction of the calf muscles and the foot plantar flexion. And the lateral stability is increased by the spread or splay of the feet. And when the lateral sway occurs, it is counteracted by hip abductors acting through the iliotibial tract. Then we are going to discuss about the gait cycle or the walking. Movements of lower limb during walking on a level surface can be divided into alternating stance and swing phases. Within these phases also there are sub-phases included. Gait cycle consists of one cycle of swing and stance by one limb, and the stance phase occupies the majority, it is 60%, and swing phase occupies 40%. But this proportion alternates when it's come to running and sprinting. In walking, stance phase is longer than the swing phase. Even though there are several sub-phases, I will describe the anatomy of walking in 4 phases. These are heel strike and support phase or the stance or weight bearing, and the toe off or push off phase and the swing phase. And when we take a one limb from one heel strike to another is the one gait cycle or one walk cycle. First we'll start with the heel strike. The stance phase starts with the heel strike. This is the initial contact of the foot with the ground, and at this point the heel touches the ground, but still the forefoot is off the ground. In this phase, the foot is need to be prepared for the immediate next phase, which the entire foot touches the ground and bear the entire body weight. With the heel strike, the knee absorbs the shock generated by the impact, and foot need to be prepared for the next immediate action, that is the entire foot touches the ground and weight bearing. So for the next phase, it need to lower the forefoot onto the ground. So this should be done by controlled manner, and this control is taken over by the ankle dorsiflexors. This means the ankle dorsiflexors controlling the movement of plantar flexion. Or plantar flexion, what happens is the forefoot brings toward the ground, but this action is controlled by the dorsiflexors so that forefoot is come down smoothly. It doesn't mean that the dorsiflexors are pulling the foot up, but rather give a control to this action. If the dorsiflexors do not control this action and the lowering of the foot happens passively, the foot would just slap onto the ground. So ankle dorsiflexors, mainly tibialis anterior, act to slow down the plantar flexion as forefoot lowers. And again, in this phase, the leg still moving forward, and this action is need to slow down or need to decelerate. Another word is it need to reverse the forward swing of the leg. This is done by the hip extensors. These hip extensors, gluteus maximus and hamstrings, decelerates the forward swing of the limb. And also for the prepare for the entire foot touches the ground and maintain the stability, and for the weight bearing, it is very important to preserve the foot arches, mainly medial and lateral longitudinal arches. So for stabilize the foot arches and to prepare for weight bearing, intrinsic foot muscles and long tendons like tibialis posterior, flexor hallucis longus, flexor digitorum longus, which are the calf muscles, and the peroneus longus tighten slightly to maintain the medial and lateral longitudinal arches. This action prevents foot from collapsing. And then the second phase is support stance or weight bearing. You can see the entire foot already touched the ground. The goal of this phase is to accept the body weight safely onto the stance leg. So now the rest of the foot from the heel strike phase has come down entirely, and the body weight begins to transfer onto that leg. Still in this phase also the foot arches need to preserve, and this preservation ongoing. At this phase, due to the body weight, the knee naturally tend to flex and act like a shock absorber. If there is uncontrolled flexion, this makes the leg unstable and unable to support the body weight properly. So what happens is the knee extensors, mainly quadriceps, control this flexion of the knee and make the knee stable. This prevents the knee from collapsing due to too much flexion. And also after the heel strike, the tibia starts to move forward over the foot as the body weight shifts onto that leg, and some ankle dorsiflexion can happen. But the ankle plantar flexors slow down this tibial forward movement and making weight transfer smooth. In this phase also, hip abductors stabilize the pelvis to prevent it from dropping onto the opposite side. The next phase is push-off. Here the heel lifts off the ground and calf pushes the toes down and make the foot stiff. And here also pelvis need to be maintained in stable position and the body propels forward. So the push-off phase goal are body need to propel forward, prepare the leg and foot for next immediate phase, which is the swing phase, and keep the pelvis and foot stable to make the push-off effective. So when heel lift off the ground, forefoot need to bear the body weight, calf muscles plantar flex the toes down, and intrinsic foot muscles like abductor hallucis and long tendons like tibialis posterior, long flexors of the toes stiffen the forefoot to bear the body weight. Gluteus medius, minimus, and tensor fasciae latae like hip abductors stabilize the pelvis on the stance leg so it doesn't drop on the swing side. In this phase, to move the leg forward, hip extensors do not contribute actively, but rather the hip mainly moves forward by the momentum or passively. Then the last phase is the swing phase. The swing phase is when the leg is off the ground and moving forward to prepare for the next step, which is the heel strike again. This phase begins after push-off when the toes leave the ground and end when the heel strikes the ground. This can be divided into three subphases: initial swing, mid-swing, and terminal swing. In initial swing, lift the foot off the ground and accelerate the thigh forward. This forefoot lifting happens due to ankle dorsiflexors, and the hip flexors lift the thigh up and move the leg forward. In mid-swing, the foot totally lifted and leg swing forward. Ankle dorsiflexors keep the foot up. In the terminal swing, as preparation for the next immediate movement or the pace, which is the heel strike, the main goal in this terminal swing is to slow down the forward motion of the thigh and leg and prepare the foot and ankle for heel strike or the next contact. So for this, hip extensors like gluteus maximus and hamstrings slow down the thigh moving, and the knee flexors, hamstrings, slow the leg and control the knee extension, and the ankle dorsiflexors like tibialis anterior mainly keep the toes lifted so the foot is ready for the heel strike. So those are the consequences of events in walking. This might be a bit complicated. So I would like you to suggest listen carefully over and over again and try to understand the anatomy behind this gait cycle. Thank you. Stay connected with Anatomy Everywhere YouTube channel.